Have you ever stopped to wonder how a nurse knows the best way to manage your pain? Or which treatment is going to get you back on your feet the fastest? Well, every single one of those decisions, it's all based on information, on data. So let's dive right in and break down how nursing researchers gather that absolutely crucial data that honestly improves all of our health.
Here's how we're going to tackle this. We're going to start real broad, just defining what data even is. Then we'll look at all the different ways researchers can collect it. After that, we'll kind of funnel our focus down to one specific method, the self-report, and the exact tools they use, before we wrap it all up with why this whole thing is so important for patient care.
All right, first things first. Every single scientific breakthrough, every piece of medical advice you've ever gotten, it all starts with the same fundamental thing, the building blocks. And in the world of research, those building blocks are, you guessed it, data. So what is data? Well, think of it like the raw ingredients for a recipe. It's the unprocessed facts and figures, the starting point. Data isn't the final answer. It's the numbers from a blood pressure cuff, the words a patient uses to describe their symptoms, or even medical images. It's all the raw stuff that researchers then shape into something meaningful. Okay, so if data is the raw material, how do researchers actually get it? Well, they don't just have one way. They have a whole toolkit of methods at their disposal. Let's open it up and see what's inside. There are a few major ways they do this. The most direct way? Just ask people. That's the self-report method. Or you could just watch what people do. Like observing how a new parent interacts with their baby. That's an observational method. You can also take direct physical measurements, like heart rate or blood work. Those are biophysiological measures. And then there's some other really specialized tools. But for today, we're going to zero in on that first one, asking people directly. So yeah, we're really narrowing our focus now to the self-report method. This is all about getting information straight from the horse's mouth, so to speak, from the patients, their families, or even other healthcare workers who are right there in the middle of it. The key idea here is it's direct. Instead of a researcher looking from the outside in, they're actually asking the person to report on their own feelings, their own experiences, their own knowledge. But how they ask those questions? Well, that turns out to be incredibly important. And that brings us to a really key concept, structure. In a structured self-report, every single person gets the exact same questions in the exact same order. Now, this control isn't about being bossy. It's about being consistent. It's the only way you can fairly compare all the answers you get later on. So what do these structured tools actually look like in the real world? Let's take a closer look at some of the most common instruments you'll find in the nursing research toolkit. The two big ones are questionnaires and structured interviews. A questionnaire is probably what you're thinking of, a form you fill out either on paper or online. The great thing is, because everyone reads the exact same text, it really helps to reduce any potential bias. Now, a structured interview is basically that same questionnaire, but it's read aloud by a researcher. The script is super strict, but because there's a real person there, you tend to get more people that actually complete it. But what about those things that are really hard to put into words? Things like pain or anxiety or even satisfaction. For that, researchers have a special kind of tool called a scale. A scale is specifically designed to do something amazing, turn a subjective feeling into an objective, measurable number. I guarantee you've seen a Likert scale before. It's the one that asks how much you agree or disagree with a statement. Strongly agree, disagree. By assigning numbers to those responses, a researcher can actually calculate a score for something as complex as life satisfaction. It's pretty cool. A semantic differential scale works a little differently. It gives you two opposite words, like good and bad or positive and negative, and asks you to mark where your feelings fall on the spectrum between them. It's a really powerful way to capture the little nuances of someone's attitude. And finally, there's the visual analog scale, or VAS. This is the classic tool for measuring pain. You've probably seen it at the doctor's office. They show you a line and ask, okay, on this line from no pain to the worst pain imaginable, where are you at right now? It's so simple, but it's an incredibly effective way to quantify a purely personal experience. So we've seen the tools, right? The questionnaires, the interviews, all these different scales. But why does this obsession with structure and measurement matter so much, especially in nursing? Well, it really all comes down to consistency. When every single person answers the exact same questions, you can be confident when you compare the results.
It takes the researcher's personal opinion out of the equation as much as possible, and it generates clean, consistent data that you can actually analyze with statistics. It's how we move from just individual stories to broad, reliable evidence that helps everyone.
And that kind of leaves us with this final thought. These tools, these scales and structured questions, they aren't just for dusty research papers. They're what allow a nurse to understand your personal experience of pain or anxiety in a way that can be tracked, managed, and ultimately treated effectively. They build that critical bridge from a subjective feeling to an objective action.